Thank you. So we're going to start with distemper, and this one I think is probably going to be a little longer than 30 minutes, but I'll try to go fast through parvo since we've already covered it a little bit already through the Boulder program, which is great. And also you've got a lot of information in your handouts from our program and the Boulder program for parvo. Okay, so distemper in Austin, we had a distemper outbreak in the spring of 2010, and we treated over 200 cases of suspected distemper. We didn't test distemper when we got the animals in our shelter. Some of them were tested at the city shelter before they came to us or before they were euthanized. And so we knew we were dealing with a distemper problem, but we didn't test every single dog. So I'm just throwing that out there because it definitely, these are assumptions. So as we worked through our dogs that we thought had distemper, we found that not all of them got neurological signs. In fact, a large portion of them didn't get neurological signs. And if they didn't, they had about a 90% save rate. So if they were over 8 weeks. So there's lots of ifs in there. But younger puppies have a much harder time. If they get just plain old pneumonia and the horrible KCS and respiratory, but no neuro signs, then we had a pretty good success rate of treating them and getting them through it. If they develop the neurological signs, then there seemed to be a higher mortality associated with them. The dogs over 4 months of age had a huge part of this, and I'm sure that if we did titer testing, we didn't do titer testing, but I'm sure if we did titer testing, we would see that it may just be titers, not necessarily age, or those probably go hand in hand, but the older puppies had a better save rate. So why bother? That's a good question, because this is a horrible disease, and it's when it goes through shelters, it wipes out a lot of dogs, and it's really difficult to treat. But what we were trying to do is save the difficult animals. So we felt like, well, we've got to try to save these dogs, especially because we were seeing that a lot of them were savable, that they were living through it. So we felt like we needed to tackle it and try to deal with it. It's a shelter disease, so these dogs that made it out of the shelter alive in the first place and then were dying of a shelter disease, it's just the tragedy of it is overwhelming too. So we again, that was another reason why we wanted to tackle it, is give these guys a chance. They already made it through the gauntlet, and then to just die of something that they picked up at the shelter is really sad. It takes a long time to fully manifest. I'm sure people already know that if anybody's seen it. And many puppies are already adopted by the time they come down with full-blown symptoms, because we don't necessarily do a quarantine period for our puppies in the summertime when we don't have a lot of, we can't keep up with the numbers that are coming in. So if they get it, then we treat it. So if they're adopted or they're in foster, we deal with it. And this is just, you guys already know this, it's spread through respiratory droplets, up to 4 feet away of coughing. You can spread it by having dirty hands going from one cage to another. It doesn't live very long in the environment, so it's actually harder to spread than parvo as far as like on your shoes or puppies licking your clothes. But it is spread through air, so that makes it much harder, especially when you're dealing with crowded environments and shelters that don't have the greatest barriers or paths to get through the shelter. So symptoms, it attacks each organ. I like to think of it as a disease that rolls through a different organ system every week. It's like the flavor of the week. Whatever the distemper decides to get, it gets. And generally, we see it start with the respiratory symptom and or diarrhea. And then that'll kind of wax and wane, and then it'll be back, and you'll start to see them improve from that first symptom, and then something else pops up. And so that might be skin problems. We've seen a couple cases of really horrible yeast infections all over their entire body. You can see KCS with the eyes stop producing tears. And conjunctivitis, of course, is pretty common. But those dogs that just won't open their eyes, I used to think it was all conjunctivitis, but and probably it's conjunctivitis, KCS induced by conjunctivitis, but they aren't producing tears. So getting them, we'll talk about treatment in a second. So we also see diarrhea. A lot of times it's bloody. These dogs are often mistaken as parvo positives, even though the test is negative. So they come to us, and the shelter might say, "This, we think it has parvo because of the bloody diarrhea, but the test is negative." And then we put it in kind of a semi-quarantine, do another test 24 hours, it's still negative. Then distemper pops up to the top of the list if we've already started antidiarrheals and antiparasites, antiparasitical treatments. And the waxing and waning symptoms, up and down fever, dry eye, tics and tremors, seizures. We see night terrors, where some of these dogs are vocalizing at night in their sleep, and they might even wake themselves up and run against the wall and run into the wall. Really strange behavior, but we've seen several cases of that. And uncommon but deadly signs, when they can't swallow, they get kind of a megaesophagus problem where their esophagus just stops working. If they can't control their breathing, we've seen several cases where dogs, it's a really weird symptom. They won't open their mouth to pant, but they can't get air. So they're labored breathing, and their gums are going in and out, but they won't open their mouth. And those are obviously deadly because they're not moving oxygen. If they can't swallow, they can't eat. We've decided, just kind of like our feline leukemia, we're not going to go through placing esophageal tubes or PEG tubes for dogs that can't swallow, but we will force feed, and we'll do a lot of supportive care. Enamel hypoplasia, I've seen several dogs come into the shelter with enamel hypoplasia and sometimes tremors, and they're not active distemper. If you see the enamel change on an incoming animal, that's a dog that you can put into your program because the disease is long gone. That's a remnant from when the disease was there and present. They shouldn't be contagious anymore. Diagnosis, it's not easy. There is a PCR test and titer testing, and we have started doing some PCR testing with the help of Dr. Levy, which has, you can see at the bottom, we tested a sample of 12 dogs, and most of those represented litters of dogs, so that was a pretty big sample pool. One was negative. This dog had seizures. He came into us with bloody diarrhea and seizures, but he was a 2-pound, some sort of terrier mix. And we always just treat symptomatically. So we've started him on dextrose and phenobarbital, and then parvo treatment, even though he was negative for parvo. And he actually came out of it in 7 days. We don't know what his problem was, but it apparently wasn't distemper. The 2 negatives, I don't believe that they were actually negative because litter mates and from those 2 dogs died of symptoms that are consistent with distemper. So I don't know if maybe those dogs just weren't shedding, or if the test just gave us a false negative, or it really is negative, and I just can't think of any other disease that would cause the symptoms of tremoring and seizures with waxing and waning upper respiratory infection. One of them maybe, but the other one definitely not. And then 9 positives. So the reason that I like that is that it helps to support that what we're seeing is what we think we're seeing when we're making these assumptions. Prevention, vaccinate before intake. That is the most important. I know we talked about it yesterday, and I'm going to kind of beat you up a little bit with some slides on it because it's the most important thing that you can do. Distemper is a man-made problem. We don't like to think that it happens in our shelters, but it does, and it is devastating. And separating dogs, trying to do some isolation when they come in and quarantine, keeping them at least 4 feet away, not sharing water bowls unless they come in together. And there's some, obviously if we all had the money to put in the great ventilation systems, it would help a lot with distemper, but we don't, and I think that we just have to follow the things above. Vaccinating before intake is the very most important thing that you can possibly do because of its ability to stop this virus. It's a very easy virus to prevent. I think that's something that we forget. It's so easy to prevent. It's really hard to treat. The importance of intake vaccines, this is a sample of the dogs. Again, none of these were tested. We treated 76 during the outbreak. 13 of those died, and that was out of 480 that we took in total. The number, that's just through the month, so you could see that huge spike in April. The vaccine guidelines, this is important, and I bolded the part that's really important. This came from AHA, and it is strongly recommended that immediate vaccination on entry be made a priority in all shelters. Delaying vaccination even by a few hours may increase the risk of infection subsequent to exposure. And that is directed at distemper. This is a disease that we can prevent if we just get on top of those vaccines. And I've worked with 2 shelters that swore they were giving the vaccines before intake, and when the procedures were actually observed, they weren't. There were huge gaps, and so some of the animals were getting vaccinated on intake and some weren't. And I like the words before intake, not on intake, because that is a specific time. Do it in the lobby. Do it before they even walk through the doors to go into the kennels. Okay, so we got the data from our city shelter of what was going on. 26, and again, we were told everybody was getting vaccinated. We knew they weren't getting vaccinated, and we knew the ones that were sick were they were in that group that wasn't vaccinated. And so there was a huge discrepancy. And this isn't to beat up our city shelter. I think that this is a problem in all large shelters, is that sometimes the right hand doesn't know what the left hand is doing. And even if you have a protocol in place, it doesn't mean that it's being followed. There needs to be follow through to make sure that somebody, especially the veterinarian, is in charge of ensuring that it's occurring 100% of the time. This is the total animals taken into our city shelter, and you can see that 37% received vaccines late or never, 63% received vaccines on time. We don't know the time they were given. That's just same day. So on time for us means same day. And I'm going back to the slide before that. The ones that we got, there's a higher prevalence in the ones that we got that were sick because we're taking the bottom of the barrel that didn't get vaccines. It makes up a higher percentage of the ones we got, not the total population at the shelter. Hopefully that makes sense. I'm kind of confusing it. These are just some examples, and it kind of shows the timeline of the disease and how long it takes to cause problems. This little adorable dog on the left, he was not vaccinated because he was an aggressive small breed dog, and he was there for 14 days with no vaccines, and then we pulled him. He got adopted immediately, and he was euthanized, a few weeks after the fact because it took that long. So that's or a little bit over a month for the disease to become fulminant and kill him. And that's one reason I think that large shelters don't even realize the importance of vaccines, because they don't see the aftermath. The animals, if there's a high percentage that are dying, then you may never even know what you're spreading in your shelter because they don't make it out. So of the ones that do, again, the bottom of the barrel are the ones that are in the bottom of the 50% that have the higher percentage of not being vaccinated, so you don't even know the harm that it's causing because they previously aren't making it out. Pedro on the right was vaccinated. He died 2 weeks after he came into the shelter, but he sat there for 4 days with no vaccines. And this little puppy came into the shelter. He was vaccinated 1 day late, his entire litter, and they all underwent treatment, and they all survived, but it was huge amount of work. Distemper, so no excuse for not vaccinating before animal intake. It's hard. It's really hard to ensure that it's happening, but I hope that you're getting it, and I'm sure that most people in this room are already aware of the importance of it. But it's the most important thing I think we can do as shelter veterinarians is to make sure that nothing happens harmful while on our watch. 100% of the animals have to be vaccinated to prevent an epidemic. And a shelter, and I liked what one of the speakers yesterday said, that unless the animal is leaving again back through the front door, it gets a vaccine, even if it's dying. I mean, unless you're taking it directly to be euthanized, and even in the case in San Antonio, we'll take animals from the euthanasia list that are sitting in the euthanasia room, and guess what? They're lined up next to a whole bunch of animals that have distemper. And if the vaccine can just be given to everybody, no matter what their outcome, that there should, in most of these big shelters, there's actually funding for that. It's just follow through, making sure that it actually happens. And it may not make sense to the person who doesn't do it, but then what if somebody like us comes on the back end and says, well, we'll take that little puppy and give it a try. But like I said, he's already been exposed to a whole bunch of bad stuff. They work immediately. So even though they're not 100% protective, if they have just a little bit of immunity, that could prevent the fulminant disease. And I think that's one reason why we saw so much pneumonia and not the full-on neuro signs, is because a lot of these animals were vaccinated, hopefully before they came into contact with the virus. So the treatment is waiting it out. It's a waiting game. You just have to react every time it acts. And so it chooses what it wants to do. It chooses which organ system it's going to ravage. It chooses how long, and you just have to wait it out. And if you can wait it out for 2 to 3 months, typically, then you win. And if the dog survives, you win. So treating the symptoms, time, 2 to 3 months is a really long time. And most, these dogs can't be in the shelter, obviously. They've got a communicable disease. So they need to be in a foster home, providing supportive care, informing your fosters of what this means. We don't do surgery if we think that they might have distemper, even if it means we have to adopt them out and then have them come back for surgery, because the stress of surgery on their immune system, if we think it's gone and then we do surgery and then it pops back up 3 days after the surgery, then we've just undone all the good that we're trying to get accomplished in the first 3 months of treatment. Systemic steroids, for some reason out there in the literature, it's, some people use steroids, and I just would caution against it because you don't want to immunocompromise them any further than they're already compromised. We do use a lot of non-steroidal anti-inflammatories, which are really helpful, but I would not use prednisone. So lowered immune system, we often see parvo with distemper. It causes susceptibility to other infections, which is why you're using antibiotics. It's a virus, we all know that, but they get secondary bacterial infections that are really terrible, and so it's critical that they're on antibiotics the whole time. Long course of treatment, and we just take it one day at a time. And that's what we tell fosters, is that every single day we'll reassess, and if we're having a particularly bad day, then we'll talk about it and see kind of where we are, and if the foster is not willing to continue, then we don't. But if they are, then we just keep going, and every day you get a little bit further down the line of the 2 to 3 month time period. So these, I adopted one of our first distemper puppies, and she had terrible bronchiectasis and just chronic pneumonia. She only lived a year. It was horrible, horrible, horrible. But I did a lot of research on what we should be doing for antibiotics and talking to specialists. And I was kind of surprised to learn that there's only 2 antibiotics that really dig down deep into the lung tissue, and that's Baytril and Zithromax. And so for dogs that have pneumonia, those are our go-to drugs. If they don't have fulminant pneumonia, we'll use doxycycline or some of the Clavamox, a lot of the other standard antibiotics. But these are the 2 that are going to penetrate down deep and hopefully prevent bronchiectasis from being the end result after the pneumonia is done. And often we have to use both because they'll spike a fever even while they're on, and we don't know if it's the virus or more bacteria. We don't have the money to do a bunch of cultures, so we're just treating empirically, which I know is not the greatest, but it works. And then supportive care. I would not recommend using one of those little boxes, but it's the only picture I could find of a nebulizer. We have like 40 nebulizers in our stock at Austin Pets Live, and we lend them out to different fosters. So when we were having terrible upper respiratory in cats, the cat people would get nebulizers and nebulizing solution. And then when the distemper outbreak happened, a lot of our fosters would have the nebulizers, and that just makes it easier for the animal to get treatment without a huge cost. And also it's something, because it's kind of like a capital cost, it's donor friendly. So you can get people to help buy those for you because it's something that will stay in the organization forever unless people don't return them, which does happen, but you want them back. And we usually just use a small crate and cover it with a sheet or a blanket and then run the nebulizer. You just have to make sure they don't get too hot. So treating the GI symptoms, deworming, making sure you've gotten rid of all the parasites because, again, they're immunocompromised. If somebody else is eating their nutrients and sucking away their life force, we want to stop that. So having them on a dewormer, a broad-spectrum dewormer, maybe we'll do all the dewormers because sometimes you don't even see coccidia on a fecal slide. But if they're having diarrhea, we just kind of throw the whole book at them. And we do fluids to keep them hydrated. Generally, the diarrhea is quick in and out. We don't see a ton of it staying there for weeks and weeks. So it might come back, like you do 7 days of diarrhea and then a few days off, and then it comes back, but then it's typically done. Whereas the respiratory can come up and down, up and down, up and down for 5 or 6 times even. Vomiting and not eating, we just treat symptomatically, Raglan, Pepcid, force feeding, trying different foods. A lot of these dogs don't want to eat because the last thing they ate made them feel nauseous, so you've got to mix it up a little bit. And our mantra is we don't care what it is, just as long as they're eating something, then we're continuing on the path of just getting through it. So that's why all these human foods are on here. Treatment for conjunctivitis. In KCS, we don't use steroids. BNP is good, is just a great eye antibiotic for dogs. And artificial tears, if you think it's KCS, which I think a lot of them are, cyclosporin, we get a lot of it donated because a lot of elderly animals die, and then people bring their meds over to us. Their owners do. And so we keep that like it's gold because we can't afford to buy it. And then we parcel out little tiny, we break it up so people get little tiny pieces of it. And It typically goes away also pretty quickly, 7 to 14 days. It's not a permanent condition, unless there's scarring to the eye from the problem. And treatment for skin, they get skin problems. They're already on antibiotics. We typically just don't worry about it. Just treat them symptomatically, oatmeal baths, cortisone cream, stuff like that. Trimmers and ticks, there's no treatment available for ticks. I read a study about Botox being used, and I'd love to see that actually put into practice, but we have not used it yet. And a lot of times it seems like the ticking comes from really central nerves, so I'm not sure how you'd get it in there, but it's an interesting thought. The only thing that stops it is general anesthesia, so there's no point in trying. I guess the point of that is there's no point in trying to find a miracle drug that is going to stop it. There's not anything out there. The gabapentin helps with pain, it seems. A lot of times they experience pain, especially at the beginning of tremors. It's something that they acclimate to, and if they go away, which is our hope, then it's worth it. But putting them on NSAIDs and gabapentin seem to be a good mix. And the ticks, Dr. Schell, who's a neurologist, said that there's nothing else that causes those ticks that you see that are kind of like the methodical jerking. And so for us, that if they do develop that neurological sign, then it sounds like we can bet that that's definitely distemper. Treatment for seizures, we use phenobarbital. We do a huge loading dose on day one. We don't send Valium home with people or IV phenobarb, so we just do a huge oral loading dose. And for the most part, that stops the seizures. And then we do a daily dose after that. Typically, they stop seizing in 7 to 10 days. Sometimes they never seize again once we load them up and keep them on it for 7 to 10 days and then wean them off. Keppra we use, it's not controlled, and so that's a great drug because you can order it and just keep it in your pharmacy, and if you have vet techs helping you prescribe this stuff, you don't have to keep track of it, which is awesome. And again, load them up and at the higher dose, and you can go a lot higher than that too. Zonisamide is also not controlled, and that's a good one. And it's important the minute somebody reports a seizure, just start them on it. There's no reason to wait until they go into cluster seizures or back-to-back seizing. Just start it immediately. Supportive care, vitamin C, puppy vitamins. Every puppy gets on every dog gets on vitamins. We do acepromazine. This is one that I don't know why it helps, but the last distemper puppy that I had I was fostering, he was having the night terrors, and the ACE really helped him sleep through the night. So I don't know why it helps, but it does. I mean, it's obviously makes him sleepy, but there's so many other drugs in this cocktail that he should be sleepy from. I don't know why ACE did the trick. And high protein diet, immune support, those they can't hurt and they might help. Newcastle vaccine, this is something that's obviously hugely controversial. There's zero really good evidence to prove that it's helpful in any way, shape, or form. We started using it because we felt like when we were having the outbreak and we had so many people invested in these animals, so many fosters invested in each individual, the fosters always find it. They always find it on the internet. So we just were like, all right, fine. If you get some, we'll try it because there's we don't know what our success rate on saving these dogs is anyway. Why not try it? And what we found is that it's not dangerous. We have had zero side effects from it. I don't think it helps, but interestingly, the 24 hours after we give it IV, they seem to be better. And I don't know if it's just the stimulation of coming to the vet clinic and getting a shot, or if it's truly related to the Newcastle, but it definitely doesn't have any long-lasting effects that I can tell. Of course, some of these animals made it, and it could be because of the Newcastle, but I don't think so. We do the IV, and then we've done the serum on, I think, a couple of dogs, but not since then. And there is somebody in Austin that does the spinal injection, and we sent 5 dogs there. They were all funded through chip-ins, and 3 of them survived. Again, I don't know if it was related to that or not. Isolation, they need to be in foster homes or someplace really far away from other dogs. Ozzy's team is a group. This little dog had distemper, and there were a group of people that shared custody of him while he was going through his treatment. And he ultimately didn't make it, but they did tons of research. They wrote up a whole bunch of stuff for people to take care of other dogs, and they developed a support group so that if our other fosters were going through it, because it's such a drain, an emotional drain, that having some people to just talk it through and be like, oh, have you tried this? And what about this recipe for food? And it's nice to have that. And I think that any city could do that with anybody that's nursed a dog through distemper becomes the expert, and then you can get them to mentor new people. These are kind of the reasons that we'll go ahead and euthanize. One is they can't swallow. We've already talked about that. We need to make sure it's not because they're too sleepy to swallow, or because of drugs, or that that it's vomiting or not wanting to eat, but that they're actually trying to eat and they can't get it down, and it keeps falling out of the side of their mouth, or it regurgitates right back up, and it's kind of that classic trying to tell the difference between vomiting and regurgitation. If they can't breathe, as long as we've had them on strong antibiotics. We've had a few cases where the foster didn't show up for their refill, and 48 hours later, the dog is in extreme respiratory distress, and we don't euthanize for that. We put them on oxygen, or before we had oxygen tanks, we would nebulize just 24/7 and start them on IV Baytril, and they actually came out of it. They started breathing better within 24 hours. So if it's because of a lapse of antibiotics, that's not a good reason to youth. But if you're already doing all the antibiotics and they still can't breathe, obviously the humane thing is to not make them keep trying. If they can't move at all, we've had some puppies that are completely paralyzed, and we decide to call it at that point. And if they can't stop seizing despite medication. And also, if the caretaker says they just can't deal with it anymore, it's not like we have distemper caretakers laying around that want to take on one of these dogs. So if they've had enough, then it's okay to youth, of course. General course of treatment is a couple of months. Our job is just to outlast it. You can pretty much bank on it being gone for good if you've had no symptoms within 10 to 14 days. So if you see your last new symptom or last recurrent symptom, and then you wait another 10 to 14 days, you can pretty much assume you're done. Even if you still have tremors or something that is continuing that is a longer lasting problem, as long as there's no new problem or worsening of an old problem, then that seems to be the end of it. And the seizures don't appear to be long-term, which is something that I had always thought was the case, but we've had 0 of these dogs go on to have long-term seizures. And the tics do continue for a long time. I have a dog that I adopted 10 years ago with distemper, and she had whole body twitches, and we really didn't know if we should euthanize her or keep her alive because we couldn't see how she could possibly sleep. But she kept eating, she kept playing, so we're like, okay, well, we'll just keep going. And after 3 years, her tics stopped altogether. So she's had no tics for the last 7 years, which I don't understand that at all, because I thought that neurological progress ends at about 6-month mark. But anyway, so I guess, like I said, where there's life, there's hope. The eyes, if they're not treated appropriately, you can lose eyes. Cataracts, we've had one dog develop cataracts after the fact, and I found an article that said that cataracts can be post-distemper. Enamel hypoplasia is to be expected. How long contagious? I don't know. No, but I don't think anybody really knows. I would assume, since this is a respiratory virus and an excretion virus, that diarrhea and coughing would be your major sources of spread. So if those symptoms are gone and gone for good, then probably it's not contagious, but I certainly wouldn't try it with an unvaccinated dog around. Okay, so this is just a case study. This is a dog named Reba that was at the shelter. She came in hit by a car. Her leg was broken. She was there for her 3-day stray hold, and she didn't get vaccinated because of her fracture. We pulled her out. We're like most of our fractures, that's not that big of a deal, so we'll take her. And the day we pulled her out, she had 104 fever, and she started to develop sniffles right after the fact. This is kind of at the beginning of our outbreak, so we didn't know that was what was wrong with her. She was over her sniffles by the time we sent her for surgery for an FHO. This is another good reason to wait on your FHO. It's a salvage procedure, and if there's any chance at all that dog's incubating distemper, there's no reason to make them go through surgery early. So the day of surgery, she developed an eye infection. We were kind of like, well, that's weird, but we didn't really pay much attention to it. Sent her to surgery. She became weak and wobbly after surgery. Her eye infection got a lot worse, and then she became really paranoid. This is a super friendly dog, and her behavior changed where she was just alarmed by things that were happening around her. She was scared of her foster, and we were like, okay, this is starting to look more like distemper. We started the Newcastle vaccine. We started her on anti-seizure medicine and oral antibiotics because her upper respiratory symptoms were back, but they weren't severe. And her fever continued to stay up, and we started her on a second antibiotic. She became paralyzed in her back end, and she was on these other medications to help deal with symptoms. And I couldn't get the video to load, but this is a picture of her. You can see her left eye is bulbous and really irritated from the KCS, and was dead at this point. Her back end, she's paralyzed, but she's walking around the yard. She would go through these wake seizures. It's one of the only dogs I've ever been bitten by, because she would, when the foster would go out of town, I'd take care of her. And she would be she'd be in the yard, and she would just kind of start running towards you. And I kept running away, and then she would stop. But then I was like, well, I wonder if she just wants comfort. So I just stood there, and she bit me right on the butt. So I think she was having some weird seizure activity, and they're not in the right head at all. Okay, so the paralysis continued. This is, of course, all distemper is bad, but this is kind of the worst it gets with the neurological symptoms. Paralysis continued. The foster noticed slight movement in one rear leg about a month after she became paralyzed. And her eye infection continued, but we decided we were not going to do surgery on that eye no matter what, because we didn't want to decrease her immune system. And she wasn't spayed yet. She was heartworm positive. She had a lot of things that she was supposed to get done that we just were like, forget it. Let's just see if she lives first, and then we'll deal with those problems later. And her seizures were under control for the most part, except for that weird activity. We started her going to physical therapy, and we had a physical therapist give us a really good deal. We were able to raise money for her through a chip-in. And here's a video of her at physical therapy. I thought I did.
It's amazing.
There we go. So her legs are all beat up from dragging.
She's allowing herself to figure out how to walk.
But she started actually getting motor function, which was unbelievable. And we kept going. The question is, why did we keep going? And again, every day this dog would eat. And you're just like, okay, when she gets to the point, we would talk. The foster and I would talk. And when she gets to the point where she doesn't feel like eating, then that's when we need to call it. And she just kept eating. Every day she kept eating. It was something different every day, but she did keep eating. So her legs continued. She can walk on all four. Her improvement continued. She can walk on all four legs now. We were finally able to do her spay 3 months after she got the disease, and her heartworm treatment after that. And then this is a video of her now, which is awesome. It's the outcome you hope for when you go through that much pain and suffering, and they go through that much pain and suffering. So she's not normal, but she's pretty close.